It's a pleasure just to share these findings because we designed a second trial, chemo-free trial for adult patients with Philadelphia positive ALL, newly diagnosed patients with no upper age limits. So in this trial, it's a phase 3, so there is a randomization between Ponatinib plus Blinatumomab versus chemotherapy plus Imatinib, but the trial is ongoing, so I will just refer to the experimental arm with Pona and Blin. We enrolled so far 151 patients with a median age of 50 years roughly, and about 27% being considered elderly. So the patient, so over the 151 patients, 96% achieved the complete remission and molecular responses at the end of induction, meaning at the end of the Ponatinib phase, is 46%. And this increases up to 74% after the 2 cycles of Blinatumomab. This indeed is turned into overall survival and disease-free survival rates of about 95%, so it's a very stunning results, definitely. And we also observed that there are no differences anymore if we consider patients who achieved a molecular response versus those who do not achieve a complete molecular responses. We have very few deaths and very few relapses. Regarding deaths, the majority of them, 4 of them, occurred during induction, and they were mostly because of either pneumonia or ileus paralyticus, and they all occurred in elderly population, whereas of the 4 relapses, those were mainly characterized by the concomitant presence of Icarus plus mutation, which we previously showed to be a deleterious factor, and 2 of them also had a T315I mutation. A single CNS relapse occurred, which is very important because in our previous trial we reported a relatively high incidence of CNS relapses. We also focused on severe adverse events and cause events that led to a temporary discontinuation of the treatment. Those were overall few and could occur both during induction as well as in consolidation. So in general, we can show that this chemo-free strategy improves further the results already observed during the ALBA trial, and in general the amount of patients who underwent allogeneic transplantation in this trial was specified according to molecular features as well as MRD persistence are very few, and no relapses, no relapse transplant-related mortalities were observed. So we are quite happy so far on the results that we obtained.